Antonia again at Elderly Medical Center. Welcome back. Today we're going to take a quick tour and speak to a few of our interpreters in our Cultural Services Department. So follow me in, we'll meet the folks and ask them a few questions. All right, here we are.
Bienvenidos.
Glenna Christie. Here we have Glenna from our Cultural Services Department. She's a supervisor here with a staff of 4. And Glenna, you want to just tell us a little bit about what is a Cultural Services Department, and what is it you're trying to do here to help patients at Elderly Medical Center?
Well, basically what we do is we help patients that come to our medical center needing healthcare services that are non-English speaking. So we help them with language services, cultural services, if we need to orientate them about how our healthcare system works here. And we also do some cultural education for our staff.
That's great. Let's just go down and meet some of the other staff we have here. First we have Irma.
Hello.
Irma's been here, what, Irma, 5 years?
I've been here 5 years.
5 years. And tell me, why did you choose to do this kind of a job? How are you helping people here at the medical center?
The way we help is I'm an interpreter. I speak English and Spanish. And the way we do is we help people communicate with the providers and staff here at the medical center.
And that makes a big difference. We think that's a great safety thing for patients and a quality concern too sometimes. If you're not hearing what the physician or provider is saying, then how can you get the right information to be healthier or to get healthier or really to take good care of yourselves? We have next, after Irma, we have Griselda, who's kind of our veteran interpreter.
Good morning.
Because Griselda's been doing this for how many years altogether?
Maybe 19 years.
19 years. So she's seen a lot. What difference have you seen in the last years, Griselda, about the difference it makes to have organized interpreting where people make appointments with you in advance and you're with them during the visit and the physicians and the providers are documenting the visit, so are you. Has that made a difference as far as people taking care of themselves or being compliant?
Definitely everything has more structure, and I think that the service overall is better. It has improved a lot, and I see that there is more safety for both parties. Patients feel more confident, and they do rely on us more.
What about the providers and the staff here? Have they accepted how this all works, how they always have an extra person with them in the room and there's a visit, for instance? Is that working pretty well?
Definitely, they do feel better, and everything goes smooth.
I know there's some issues sometimes about families interpreting, and we don't want family members to interpret for patients. And why is that?
Well, I just think that there is too much emotional attachment to the situation, and the information is not complete how it should be to be able to provide.
And that's what we talk about when we talk about safety, is those kinds of issues, getting the right information directly from your physician or your provider, any staff here. Thank you, Griselda.
You're welcome.
Moving down to Antonia. Antonia's been here.
This is my second year.
Second 2 years?
I did 2 years also as the casual interpreter before
Okay.
that.
So we have Antonia also interacting with patients. How does it work lots of times? What if a family member says, you know, I don't need your help because I have my daughter here helping me today? How do you handle a situation like that?
Well, the way we do it is it goes back to being the provider's call.
Okay.
He has the last say so as far as if he feels comfortable, if that individual is providing the accurate interpretation, because it's his license that's on the line as far as that goes.
That makes really good sense. You know, it would be great, I think, if every English-speaking person had an interpreter, just because there's a second pair of ears to hear what's being said, and in an emotional time you've got somebody else that's not emotionally involved that can understand and remember what's been said. Another question, where else do we go other than the physician's offices? Where else do you interpret here?
We do lab, we do x-rays, or radiology, I should say, HDU, Health Reach. We go out to the satellite clinics and
Okay.
and stuff, oncology.
So it's pretty much every service we have here, we have an interpreter to help people that don't speak English. It's not just Spanish either. Now these are Spanish speaking interpreters, but we do have access to the language line here too, so that we can introduce other languages. It's a telephone thing where we get a person that speaks the language of the patient and they can converse over the phone with the provider. So we think we cover everything, although Hispanic is our biggest population other than the English speaking folks. Glenna, do you have anything you want to add about our services or how you think we've made a difference?
Yes, I'd just like everybody to know that our services are free of charge for our patients and that we are available 24/7, and like Patty mentioned, for any service, any language that you need here at the medical center.
That's great. Well, thank you for joining us today. You need more information, we are here at Albert Lea Medical Center in Albert Lea, Minnesota. Happy to help anybody or talk about what we do here. See you next time.
Thank you.